Hi there, I am Dr. Vivek A.N. I've been practicing orthopedic surgery for the last 15 years. I'm going to talk about total hip replacement surgery. Before that, what does the hip joint consist of? It consists of the pelvic bone. Here it shows half of the pelvic bone on the right side. This is the right side pelvic bone and the thigh bone. It forms a major joint which bears entire body weight in the cycle of gait. Now, there are various reasons why the hip joint can become painful. One of the common causes is arthritis of the hip. Like we have arthritis of the knee joint, the hip can also become arthritic because of wear and tear. Other reasons of the hip becoming arthritic would be avascular necrosis, where the blood circulation to the bone becomes less. It can be injury. Following injury, the bone may not heal as per expected, so it becomes arthritic, where the normal roundness of the bone goes away and the cartilage which covers the joint becomes rough. So this causes symptoms in terms of restriction of activities, unable to squat or sit cross-legged, use the stairs, and reduces the mobility. So what is the solution for such a kind of a condition? Yes, one of the most successful surgeries in orthopedic surgeries has been the total hip replacement surgery, where the cup which forms in the pelvic bone is inserted with a cup, and the head of the femur, that is the head portion, is chopped off, and we use a prosthesis which fits into the bone. Now this would articulate with the other side and would solve the problem of the roughness which is caused by arthritis. There is another common reason why we do total hip replacement, that being falls and fracture of the head of the femur. Now, with the advancing age and the weakness which sets in the bone, commonly we come across fractures of the hip, where total hip replacement is the only solution for those people and solves the problem.